I mean, in the back of my mind, I knew something was wrong, and it was not going to be good. He sat us down, and first thing he says is, "I hate to tell anybody this," he says, "but what you got is terminal. There's nothing we can do for you, so you need to get on the lung transplant list." And of course, my wife was devastated. I've never had anything wrong with me ever. I don't take any kind of medicines for blood pressure or heart medicine, and I'm 58. I've got people that I work with that are 40 and 50 that are taking all sorts of medicines and whatnot. So.
The term idiopathic pulmonary fibrosis really means scarring of the lungs, and we don't know why you have it. But it's a very specific subset of patients who have scarring of the lungs that we don't know why they have it. And what's particularly important about this subset is that their prognosis is worse than many cancers. So a median survival of 3 to 5 years is truly worse than many, if not most, cancers. We were following him in clinic, and we could see that every time he came into clinic there was a continued decline in his breathing tests. And we know that in individuals who have continued declines in their breathing tests, those are individuals who are very high risk to die. But despite that, the other, I think, fantastic thing about him is that we asked him to lose weight, and he lost weight. We asked him to exercise, and even though he didn't feel well, and even though it took lots and lots of oxygen to allow him to exercise, he exercised. So he is, I think, a very good example of what we really hope for.
Mr. Happy-Go-Lucky, failure is not an option. That's why he is the perfect person for lung transplant, because he will just surprise everyone, I think.
As far as the procurement for Mr. Flurett, things were routine. Once the organs arrive here in the hospital, as you saw with Mr. Flurett, they come in this ice chest, and there are several bags that are all packed sterilely at the donor hospital to make sure the lungs stay sterile throughout the entire process. The lungs are lifted from the ice chest into sterile basins on the OR back table. And when we take the lungs, they come out as a block. The two lungs attached together with the donor's trachea, and also part of the left atrium, the back of the donor's heart. Dividing the left atrium and dividing the airway, and also the main pulmonary artery. And then we place the right and left lungs into each of their own sterile basins on ice. And typically at this point, whoever started the operation, one of my cardiac colleagues, has placed the patient on cardiopulmonary bypass and has started removing the recipient's lungs. And then I assist with the rest of the operation, removing the diseased lungs and then sewing in the donor lungs.
So they come in and they get their surgery. You know, when do they get off a breathing machine? Well, most folks are off the breathing machine within 2 days. And when do they get out of the intensive care unit? The average time in the intensive care unit is about 4 days or so. And then when is the average time that people get out of the hospital? Here at MUSC, our average time is just about 2 weeks, a little bit less than 2 weeks. So we really get you up, we get you walking, we get you out of the hospital quickly. Full recovery till you feel like you're at your best is 6 months.
Tremendously better. I don't have any hoses, I can breathe, I can sit around the house without the wife trying to choke me to death by cutting off my oxygen.
Having my husband back, having the person that I married and the person that I remember, instead of this very frustrated person that can't breathe and is attached to the umbilical cord of oxygen, having life return much more to normal.
My goals are to finish up rehab sooner than they want me to and go back to work full time.
And it's just such a miracle, I guess. That's what comes to my mind, is that here I have him back, and this is what, 3 weeks out from this transplant, and he is as normal as he was the day that I married him and the day that I met him. So to me it's just amazing, the transformation in 3 weeks.